Okay, let's briefly discuss the interconnections between stress and fertility. Okay, if the diet is high in trans and saturated fatty acids, or if the diet is high in sodium, caffeine, free sugars, alcohol, processed carbs, and so on, these can lead to nutrients deficiency. This can also increase a person's risk for inflammation and oxidative stress. Oxidative stress can mean excessive levels of free radicals, which inhibits the cell's ability to clear these radicals. And if our diet is high in trans and saturated fatty acids, sodium, caffeine, free sugars, alcohol, processed carbs, and so on, these can increase our risk for anxiety and stress. We can also get jitters. It can also affect our mood. Having diets like this can affect our heart rate, or it can increase our risk for sleep problems. And nutrient deficiency, inflammation, or oxidative stress can lead to different kinds of reproductive challenges. And if we have better nutrients for our brains, this can lead to better moods, and these can be less stressful for us. And if our diet is high in whole grains, dairy, vegetables, fish, unsaturated fats, and so on, these can increase our chances of reproductive success. Okay, laptop. Can we put our laptops on our lap just for convenience sake? Because after all, it is called a laptop. So, can we put a laptop on the lap, especially for long hours? According to research, the electromagnetic fields in laptops can increase the scrotal temperatures, and this can affect or compromise the quality and quantity of sperm. So, according to researchers that focus on this area, the electromagnetic fields contained in laptops can increase scrotal temperatures, and this can compromise the quality and quantity of sperms for men. And the radio frequency can also be harmful, especially for males. It can decrease sperm motility or increase sperm DNA fragmentation. And all these can affect the quality and quantity of sperm. And these may increase the risk for male infertility. Okay, stresses through our jobs, through life events, stresses resulting from natural disasters, or other hazardous conditions. Here, we mean prolonged stress, not acute or temporary stress, can affect the semen count and quantity, or quality, sorry. So let me repeat, stress due to our jobs, job-related stresses, or stresses because of changes in different life events, divorces, deaths, separation, and so on. Sometimes natural disasters, tornadoes, floods, storms can also increase a person's stress. And other hazardous conditions can also increase a person's stress. This can affect the semen count and quality. And certain kinds of personalities, like being assertive or confrontational, can lead to the binding of adrenaline and non-adrenaline to alpha 1, alpha 2, and beta adrenergic receptors. And this can increase adrenergic activation. These in turn increase vasoconstriction in the testis area. I think vasoconstriction means the tightening of blood vessels. This in turn decrease testosterone levels, and this ultimately lower spermatogenesis. I think spermatogenesis means gametes development. So, as we can see, being under prolonged stress or having a certain kinds of personality can compromise reproduction success through these pathways. Okay, sometimes fertility treatment can be counterproductive. Fertility treatment like medically assisted reproduction or assisted reproductive technology, sorry for the typo, and other kinds of fertility treatment. All these can be physically demanding, and it can also be quite stressful if the patient expects certain outcomes, or if the patient in certain cultures are under certain kinds of pressure to reproduce, to have babies or have a large family. So, if people expect success through these treatments and they are afraid of failure, just imagine all these treatments, whether it's MAR or ART and other fertility treatments, they all can be stressful. They can not only be physically demanding, but failure in vitro fertilization treatment can also induce stress on the couple, and this can be counterproductive. This can further minimize the couple's chance of conception, as confirmed by research. And certain medications to treat fertility, like clomiphene, leuprolide, gonadotropins, and so on, they can increase a person's risk for anxiety, depression, irritability, and so on. Essentially, these medications can affect the person's mental state. And all these mental health outcomes, like anxiety, depression, irritability, are obtained through self-report data or by assessing the biomarkers like salivary alpha amylase, or by collecting hair samples from the patient, or by measuring the cortisol levels of the patient. And this can affect the treatment effectiveness. In other words, if the person is going through fertility treatment and the person is also taking some of these medications to treat fertility, they can be counterproductive, or the patient may not achieve his or her intended outcomes. So these are the references I use.